The Oregon Health Plan says no to chemotherapy and yes to assisted suicide. In a letter to a Eugene cancer patient, the state explains it will not cover the cost of her chemo, but it will pay for doctor-assisted suicide.
Quite a story. K2's Susan Harding investigates how this one letter is raising big questions about the health plan's priorities.
Can you say hi? Huh? Yeah. Wag that tail.
Barbara Wagner has one wish for more time.
I'm not ready. I'm not ready to die. I've got things I'd still like to do.
Her doctor offered hope in this bottle, the new chemotherapy drug Tarceva.
Like my doctor said, maybe this can put the lid on it and stop it.
That hope shattered with this letter from the Oregon Health Plan telling her we were unable to approve the cancer treatment. It will pay for comfort care, including physician aid in dying, better known as assisted suicide.
I told him, I said, who do you guys think you are? To say that you'll pay for my dying, but you won't pay to help me possibly live longer.
We took her concerns to Dr. Sam Saha, chairman of the commission that sets policy for the Oregon Health Plan.
She says to say to someone, we'll pay for you to die but not pay for you to live, it's cruel.
I don't think anyone's saying that. I don't think anyone's saying that. That's, I think, maybe an unfortunate interpretation of the letter.
Assisted suicide critic Dr. William Toffler calls the message disturbing.
People deserve relief of their suffering, not giving them an overdose.
And he says the state has a financial incentive to offer death instead of life. Chemotherapy drugs like Tarceva cost $4,000 a month. Drugs for assisted suicide cost less than $100.
Is it cheaper to pay for somebody to die than to help them live?
That is not a question that we think about. We don't think about investing our healthcare dollars in that way.
Yet when thinking about patients like Barbara Wagner, Dr. Saha admits they must consider the state's limited dollars.
If we invest thousands and thousands of dollars in one person's days to weeks, yet we are taking away those dollars from someone.
So you look at average, you say it's just a few weeks. And that's true. But it's not true for everybody. Okay, some people have incredible responses.
At the Willamette Valley Cancer Center, where Wagner gets her care, the medical director says the Oregon Health Plan has not kept up with the dramatic changes in chemotherapy.
You could be denying somebody years of their life.
Absolutely you could.
Even for those with advanced cancer, new chemotherapy drugs can extend life. Yet the Oregon Health Plan offers coverage for chemo that cures cancer, not if it can prolong a patient's life.
We're looking at today's treatment, 2008 treatment, but we're using 1993 standards. When the Oregon Health Plan was created, it was 15 years ago. And there were not all the chemotherapy drugs that there are today.
Like Tarceva, that can add years to some patients' lives.
If there is a chance, if there's any kind of a chance at all, can we try it? Instead of just saying, no, you're not worth it?
Patients who are denied coverage can appeal the decision. In Wagner's case, she appealed twice and lost both times. Her doctors contacted the pharmaceutical company Genentech, which agreed to give her the medication without charging her. But doctors tell us that is very unusual for a company to give away such expensive medication.